Hello everyone, I am Dr. Siad, MBBS, MD in Health Informatics. Welcome to the NCLEX-RN course series. In this tutorial series, we are going to discuss the nursing care of adults with medical and surgical issues. We are going to discuss with the latest next generation NCLEX-RN type question. So please follow my channel. Adult Nursing Respiratory System Problems 20 question and answers. Question number 1, multiple response, select all that apply. The nurse is providing discharge instructions to a client diagnosed with tuberculosis. Which statement should the nurse include in the teaching? A. You must remain in respiratory isolation at home to protect your family. B. You will need to provide a sputum culture every 2 to 4 weeks. C. You can return to work once you have one negative sputum culture. D. Activity should be resumed gradually to prevent fatigue. E. Cover your mouth and nose with a tissue when coughing and dispose of it in a plastic bag. So think the answer and select all correct statements. So the correct statements are B, D and E. So when you look at the answer B, you will need to provide a sputum culture every 2 to 4 weeks. This is correct. That means the regular sputum cultures are necessary to monitor treatment effectiveness and determine when the client is no longer infectious. And when you look at the answer D, it says activity should be received gradually to prevent fatigue. Here, the TB and its treatment can cause fatigue, and gradual resumption of activities helps promote recovery without overexertion. When you look at the answer E, cover your mouth and nose with tissue when coughing and dispose of it in a plastic bag. This is correct. Proper cough etiquette reduces the spread of airborne droplets and is essential infection control measure. So when you look at the incorrect answers, you can see answer A. It says you must remain in respiratory isolation at home to protect family members. Actually, respiratory isolation at home is not required because family members have already been exposed. So after 2 to 3 weeks of appropriate medication therapy, the client is unlikely to be infectious. When you look at the answer C, you can return to work once you have one negative sputum culture. It's wrong. Actually, the client is typically allowed to return to work after 3 consecutive negative sputum cultures, not just one. Question number 2, clinical judgment matrix. A client is admitted for a blunt chest injury. For each assessment finding, click to specify if the finding is consistent with the condition. So on the left side, there's a finding, right side, the condition. So you have to click which condition is appropriate here. So the correct answers are the paradoxal chest movement is for flail chest. Actually, the flail chest occurs when multiple ribs are fractured in 2 or more places, creating a free floating segment of the chest wall. This causes the affected area move inward during inspiration and outward during expiration, which is a hallmark sign unique to flail chest. And second, pain, especially on inspiration, that is rib fracture. Rib fractures cause localized chest pain that worsens with inspiration, coughing or movement due to irritation of the periosteum and chest wall muscles. This pain often leads to shallow breathing, and diminished breath sounds are feature of pneumothorax. Pneumothorax results from an air in the pleural space, leading to partial or complete lung collapse. This causes decreased or absent breath sounds in an affected site. Question number 3, drop down, that is closed type question. The nurse is assessing a client for acute respiratory distress syndrome. The drop down sign of ARD is drop down 2. So you have to select from the drop down answers. So drop down answers are earliest and latest, and the drop down 2 answers are intercostal retraction, increased respiratory rate, and cyanosis. So you have to select one from drop down 1 and one from drop down 2. So the correct answer is the nurse is assessing a client for acute respiratory distress syndrome. The earliest sign of ARDS is increased respiratory rate. The rationale is the earliest detectable sign of acute respiratory distress syndrome is an increased respiratory rate, which may occur within hours of initial insult as the body attempts to compensate for impaired gas exchange. Intercostal retractions and cyanosis develop later as respiratory distress worsens and oxygenation continues to decline. Question number 4, multiple choice strategic word. Which diagnostic test will confirm the diagnosis of tuberculosis? A. Chest X-ray. B. Tuberculin skin test. C. Sputum culture. D. Bronchoscopy. Think the answer. The correct answer is C. Sputum culture. A sputum culture is definitive diagnosis test for tuberculosis because it confirms the presence of Mycobacterium tuberculosis by isolating the organism. When you look at other answers like chest X-ray, it may show abnormalities suggestive of TB but cannot confirm the diagnosis. Similarly, answer B, tuberculin skin test, it indicates exposure, not active disease. And answer D, bronchoscopy may obtain specimens but does not itself confirm TB unless cultures grow the organism. Question number 5, multiple response, select all that apply. The nurse assesses a client with advanced COPD. Which findings are expected? A. Flattened diaphragm on the chest X-ray. B. Increased vital capacity on pulmonary function test. C. Hyperinflated chest. D. High arterial PCO2 levels. E. Increased oxygen saturation with exercise. So here you have to select multiple answers. The correct answers are A, C, and D. Actually, the clients with advanced chronic obstructive pulmonary disease experience chronic air trapping and impaired gas exchange, leading to following expected findings. So, the answer A, flattened diaphragm on chest X-ray. Actually, chronic lung hyperinflation pushes the diaphragm downward, causes it to appear flattened on imaging. When you look at the answer C, hyperinflated chest. Air trapping causes lung overexpansion, producing a hyperinflated or barrel-shaped chest. Answer D, high arterial PCO2 levels. In advanced COPD, impaired ventilation leading to chronic hypercapnia. When you look at the answer B, increased vital capacity on pulmonary function test. Actually, it's wrong. COPD result in decreased, not increased, vital capacity due to airflow obstruction. When you look at the answer E, increased oxygen saturation with exercise, it's also wrong. Oxygen saturation typically decreases with exercise because the lungs cannot meet increased oxygen demands. Question number 6, drag and drop style question. The nurse is reviewing common pulmonary disorders and they are distinguishing clinical features. Drag each clinical manifestation to disease most commonly associated with it. So on the left side, disease is listed. On the right side, clinical manifestations. So in CAT type of stack exam, you have to drag and drop the correct answer matching to these diseases. So the correct answers are include pulmonary embolism. The characteristic clinical manifestation is sudden chest pain. Actually, the pulmonary embolism most commonly presents with sudden onset chest pain, often accompanied by dyspnea and tachypnea due to obstruction of pulmonary blood flow. And silicosis, the clinical manifestation is restrictive lung disease from dust. Silicosis results from chronic inhalation of silica dust, leading to lung inflammation, fibrosis, and restrictive lung disease. Answer C, sarcoidosis. Manifestation is early dyspnea or dry cough. Sarcoidosis is a systemic inflammatory disease that commonly affects the lungs with dry cough and dyspnea as early manifestations. Histoplasmosis manifestation is opportunistic fungal infection. Histoplasmosis is a fungal infection that commonly occurs as an opportunistic infection, especially in immunocompromised clients such as those with AIDS. Question number 7, multiple choice. A client with emphysema is experiencing a period of severe dyspnea. Which position should the nurse instruct the client to assume? A. Side lying with the head of bed flat. B. Sitting in a recliner chair. C. Sitting up and leaning on the overhead bed table. D. Supine with a pillow under the knees. Think the answer. The correct answer is C. Sitting up and leaning on over bed table. You can see the position is the tripod position. This is the sitting position and this is the standing position. So clients with emphysema experience air trapping and difficulty with expiration, especially during periods of severe dyspnea. The best position to improve breathing is the tripod position, that is sitting upright and leaning forward on an overbed table. So this position maximizes lung expansion, enhances the use of accessory muscles, decrease the work of breathing, and improve ventilation and oxygenation. Question number 8, multiple response, select all that apply. A community health nurse is teaching a seminar on TB symptoms, which should be identified as symptoms of TB. A. Night sweats. B. Bloody productive cough. C. Weight gain. D. Persistent mucous sputum. E. Severe headache. So think the answer and select all suitable answers. The correct answers are A. Night sweats. B. Bloody productive cough. And D. Persistent mucous sputum. Tuberculosis commonly presents with chronic respiratory and systemic symptoms related to ongoing infection and inflammation. When you look at the answer A, night sweats is a classic systemic manifestation of TB due to prolonged infection. And B, bloody productive cough. This occurs from lung tissue involvement and air irritation. When you look at the answer weight gain, actually it's wrong. The TB associated with weight loss, anorexia and fatigue, not weight gain. Answer D, persistent mucoid sputum. It's correct. A chronic cough with sputum production is a hallmark of TB. When you look at the answer E, severe headache. Headache is not a typical respiratory symptom of pulmonary TB unless TB meningitis is present, which is not implied here. So the correct answers are A, B, and D. Question number 9, multiple choice. Which dietary instruction should the nurse provide to a client with tuberculosis to promote healing? A, high carbohydrate, low protein diet. B, foods rich in iron, protein, and vitamin C. C, low sodium, high fat diet. D, vitamin D and calcium restricted diet. Think the answer. The correct answer is B, foods rich in iron, protein, and vitamin C. Actually, the tuberculosis is a chronic infectious disease that increases the metabolic demands and often lead to weight loss, fatigue, and impaired tissue healing. To promote recovery and support immune system, the nurse should encourage a diet that includes protein, which supports tissue repair and immune response, and iron that helps prevent anemia and improve oxygen transport, and vitamin C enhances immune function and promote healing. When you look at other answers, high carbohydrate, low protein diet, actually protein is essential for healing, so restricting protein would impair recovery. And answer C, low sodium and high fat diet. Actually, fat intake is not the priority and sodium restriction is not indicated in TB. And vitamin D and calcium restricted diet, actually there's no indication to restrict these nutrients in TB. Doing so could be harmful. So the correct answer is answer B. Question number 10, matrix type question. The nurse is reviewing infection control precautions for clients with communicable diseases. For each clinical diagnosis, select the appropriate type of transmission-based precaution the nurse should implement. So the clinical conditions are here, airborne precautions and droplet precautions. So you have to tick the correct answer. For the tuberculosis, airborne precaution is indicated. Because tuberculosis is transmitted via airborne droplet nuclei that remain suspended in the air for long periods, clients require negative pressure room and healthcare workers must use N95 respirators or equivalent protection. Influenza, you have to have droplet precautions because influenza spreads through large respiratory droplets expelled during coughing, sneezing, or talking. So, droplet precautions with surgical masks are required when within close contact. On the other case, measles, so here the airborne precaution is mandated because measles is highly contagious and spreads through airborne transmission. Strict airborne precautions, including a negative pressure room and N95 respirator, are necessary. Question number 11, multiple choice. Which finding is a hallmark of early acute respiratory distress syndrome? A, refractory hypoxemia. B, respiratory acidosis. C, elevated carbon dioxide levels. D, severe electrolyte imbalances. So think the answer. The correct answer is A, refractory hypoxemia. So the refractory hypoxemia means low blood oxygen levels that do not improve the supplemental oxygen. It's the hallmark finding of early acute respiratory distress syndrome. So you can see in the picture, in acute respiratory distress syndrome, inflammation damages the alveolar capillary membrane. You can see here, and fluid leaks in the alveoli, so gas exchange becomes severely impaired. So when you look at other answers, respiratory acidosis, this is a typically a later finding occurring after prolonged hyperventilation or respiratory failure. So this is not the hallmark of early respiratory distress syndrome. And C is elevated carbon dioxide level. So the CO2 retention usually develops after severe lung destruction progresses, not in early stage. Similarly, in answer D, severe electrolyte imbalances. Electrolyte disturbances are not defining feature of ARDS and may result from other complications or treatments. Question number 12, ordered response. A nurse receives a report of 4 clients. In what order should the nurse assess them? So in the CAT exam, you have to drag and drop in the correct order. So answer A is client with chronic sinusitis is reporting a headache. B. A client with TB who just coughed up 50 milliliter of bright red blood. C. A client with COPD with an oxygen saturation of 91%. And D. A client with heart failure who gained 2 lbs overweight. So think the answer. So the correct order is first, a client with TB who just coughed up 50 milliliter of bright red blood. Actually, the bright red blood indicates acute hemoptysis, which is medical emergency. So, which is high risk for airway compromise, hemorrhage, and aspiration. And next is a client with COPD with an oxygen saturation of 91%. Here, the oxygen saturation 91% is low normal for COPD, but still indicates potential respiratory compromise. So, requires prompt assessment to ensure the client is not deteriorating. So breathing problems always take priority after immediate life threats. So this is the second priority. And third one is a client with heart failure who gained 2 lbs overweight. So here the rapid weight gain suggests fluid retention and bursting heart failure. It is important but not immediately life-threatening without signs of respiratory distress. And finally, a client with chronic sinusitis is reporting a headache. Here headache is a common expected symptom of sinusitis. Client is stable with no airway breathing or circulation threat. So this is the last priority. Question number 13, multiple choice. What is the correct question for a client experiencing an acute epistaxis, that is nosebleed? A. Tilt the head backward and pinch the nose. B. Lie down flat with an ice compress. C. Sit down, lean forward and pinch the soft portion of the nose. D. Blow the nose gently with the neck flexed. Think the answer. The correct answer is C. Sit down, lean forward and pinch the soft portion of the nose, as done here. For active epistaxis, the correct question is to sit upright, lean forward, and apply firm pressure to the soft portion of the nose for 10 to 15 minutes. This position prevents blood from flowing into the throat, reducing the risk of aspiration and nausea, and allow blood to drain outward so bleeding can be assessed, and promotes compression of Kesselberg's plexus, the most common site of anterior nosebleeds. Question number 14, multiple response, select all that apply. A nurse is assessing a client with right-sided heart failure secondary to COPD. Which findings should the nurse expect? Select all that apply. A. Peripheral edema. B. Hypertension. C. Jugular venous distension. D. Increased appetite. E. Hepatomegaly. Think the answer and select correct answers. So the correct answers are A, C, and E. When you look at the answer A, that is peripheral edema, the right-sided heart failure causes systemic venous congestion, leading to fluid accumulation in dependent tissues such as the ankles, feet, and legs. When you look at the answer B, that is hypertension, it's wrong because hypertension is more commonly associated with left-sided heart failure or may be contributing cause, but it is not a hallmark finding of right-sided heart failure. Answer C, jugular venous distension is correct because elevated right atrial pressure leads to jugular venous distension, a classic sign of right heart failure. And answer D, increased appetite is strong because clients with right-sided heart failure often experience anorexia, nausea, or early satiety due to liver and gastrointestinal congestion, not increased appetite. Answer E, hepatomegaly is correct. Venous congestion of the liver results in enlarged tender liver, that is hepatomegaly, and may cause a right upper quadrant discomfort. Question number 15, multiple choice. A client with bacterial pneumonia is receiving oxygen via nasal cannula. Which finding best indicates the oxygen therapy is effective? A. Respiratory rate decreases from 28 to 24 per minute. B. Client reports less chest pain. C. Arterial blood gas values show improved PaO2. D. Breath sounds are clear bilaterally. So think the answer. The correct answer is C. Arterial blood gas values show improved PaO2. Actually, that arterial blood gas values, specifically PaO2, are the most accurate indicator of oxygenation. So an improvement of PaO2 directly reflects that oxygen therapy is effectively increasing the amount of oxygen available in the blood and improving gas exchange in a client with bacterial pneumonia. Question number 16, drag and drop style question. A nurse is providing a care for clients receiving medications commonly used to treat respiratory conditions. Drag each medication to the primary nursing concern.
that requires monitoring or client teaching. So you have to drag and drop to the correct combinations. So the correct answers are medication and nursing concern, isoniazid for hepatotoxicity. Isoniazid can cause liver inflammation and liver failure. The nurse should monitor liver function tests, that is AST and ALT, and instruct the client to report symptoms such as fatigue, jaundice, dark urine, or abdominal pain. And next, rifampin, the nursing concern is orange colored urine. Rifampin commonly causes orange or reddish discoloration of urine, sweat, tears, and saliva. This effect is harmless but important to teach so the client is not alarmed. And finally, is theophylline. So the nursing concern is seizures and insomnia. Theophylline has a narrow therapeutic range. Toxicity can cause CNS stimulation, including restlessness, insomnia, tremors, and seizures, requiring close monitoring of serum drug levels. Question number 17, multiple response, select all that apply. Which findings require immediate intervention in a client with COPD? A. Perceived lift breathing. B. Inability to speak. C. Barrel chest. D. Circumoral cyanosis. E. Diminished breath sounds. Think the answer. The correct answers are B. Inability to speak and D. Circumoral cyanosis. So the inability to speak is a sign of severe respiratory distress. When a client cannot speak, it indicates inadequate ventilation and impending respiratory failure requiring immediate intervention. Other answer is circumoral cyanosis. This bluish discoloration around the mouth indicates hypoxemia. This is a late and dangerous sign of inadequate oxygenation and requires urgent action. When you look at other answers, answer A, perceived lift breathing. This is a protective compensatory technique commonly used by clients with COPD to improve ventilation and reduce air trapping. This is expected and not emergent. When you look at the answer C, barrel shaped chest reflects the chronic hyperinflation of the lungs. It develops over time and it is not an acute or emergency finding. When you look at the answer E, diminished breath sounds, this is a common chronic finding in COPD due to air trapping. While it should be monitored, it does not require immediate intervention unless accompanied by acute distress. Question number 18, multiple choice. A 68-year-old client with COPD presents with dyspnea and PaO2 of 56 millimeter mercury. Which statement is true? A. Oxygen is contraindicated. B. High oxygen may suppress respiratory dive. D. Oxygen causes dependency. D. Oxygen worsens CO2 retention in all cases. Think the answer. The correct answer is B. High oxygen may suppress respiratory drive. Clients with chronic obstructive pulmonary disease often rely on a hypoxic drive to stimulate breathing rather than the normal carbon dioxide drive. When high concentration of oxygens are administered, the hypoxic stimulus to breathe may be reduced, respiratory rate and depth can decrease, so this can lead to hypoventilation and worsening hypercapnia. So when you look at other answers, oxygen is contraindicated. Here oxygen is not contraindicated in COPD. It is essential when PaO2 is low but must be administered carefully. When you look at the answer C, oxygen causes dependency. Oxygen does not cause physiologic dependence. Needing oxygen reflects disease severity, not addiction. Answer D, oxygen worsens CO2 retention in all cases. Here, oxygen may worsen CO2 retention in some clients, but not all cases. So, making this statement too absolute. So, the correct answer is answer B. Question number 19, ordered response. Place steps for using a meter dose inhaler correctly. So, you have to drag and drop in the correct order. So think the answer. The correct order is first, exhale fully. So exhaling completely empties the lungs, creating space for the medication to reach deep into the airways. And second is activate inhaler while inhaling slowly. So slow, deep inhalation coordinated with activation allows the medication to deposit in the lower airways rather than in the mouth or throat. And third step is hold the breath for 10 seconds. Holding the breath gives the medication time to settle in the alveoli and improve absorption. And finally, wait for second puff. So waiting usually 30 to 60 seconds allows the first dose to open the airways, ensuring better delivery of the second puff. Question number 20, multiple choice. Which chest tube finding indicates proper function? A. Continuous bubbling in the water seal. B. No fluctuation at all times. C. Tidalling with respiration. D. Sudden increase in drainage. Think the answer. The correct answer is C. Tidalling with respiration. So the tidalling is the normal rise and fall of the fluid in the water seal chamber of the chest tube, draining system that occurs with inspiration and expiration. During inspiration, negative intrathoracic pressure causes the fluid level to rise, and during expiration, the fluid level falls. So when you look at other long answers, continuous bubbling in the water seal. Actually, this continuous bubbling indicates an air leak. This is not a normal function. Answer B, no fluctuation at all times. So absence of tidalling may indicate lung re-expansion or tube obstruction by itself. It does not confirm proper function. And answer D, sudden increase in drainage. So sudden increase in the drainage, especially if bloody, may indicate hemorrhage and requires immediate assessment. And the bonus question, multiple response, select all that apply. Which findings require stopping prone positioning in ARDS? A. Decreased SpO2. B. Hypotension. C. Family visiting. D. Skin breakdown. So think the answer and leave the answer in the comment section with your rationale. So this is the end of respiratory problems in adult clients.
If you have any queries or any issues, please leave in the comment section. So if you have any issues, you can contact me using my WhatsApp and email provided in the description. Please subscribe my channel and stay with me. Thank you.